Great question. So this is very common. Patients that come in with broken implants are like, what the heck happened? Nothing happened to me. I didn't have any trauma. How did my implant break? A few different areas can cause breakage or leakage of breast implants. So first of all, you always have a little bit of gel bleed, and this particular company has a thicker shell and has I think a better prevention of gel bleed. But I think you're talking about like big ruptures where it's just a ball of goo when you go inside. So one of the things that can happen is this little fill patch on the end sometimes can become dislodged, and the leakage can be the source right here, the fill patch. That's not very common though. Usually what I see is kind of, it almost looks like a rip in the implant. And that can happen for two reasons. So reason number one, the implant was shoved through too small of an incision and it ripped on the way in. And the surgeon didn't recognize it because it was a tiny incision with a big implant. So that's one way that the implant can become ruptured. The other way is that your implant sits on your chest like this and you have all of these ripples. And with years of wear and movement, sometimes you can get a weak area at the area of a ripple, or sometimes the implant can fold, which can give a lot of movement in a weak area, and then the implant can rupture. So you're right, the implants are really, really tough. Like it's like nearly impossible for me to try to break this. I have stepped on it with high heels. I've seen people run over them with cars and they didn't break. These things are really, really strong. And if you see the wear tests, they put them in these machines, and I think it's 6 million times they're required to compress them, and they're compressed like over and over again, which stresses the implant, and they make it through with flying colors. But even with a really strong implant, with time and repeated stress for many, many, many years, you can have potentially ruptured devices. In videos like this, I always want to take the opportunity to remind everyone with silicone implants that you need monitoring of your implants because they can break, and because when they break, you may not know about it. So saline implants, again, go flat. Silicone implants don't. And so if they break, you may not be aware. And it's a good idea to learn about the break as soon as possible so you can have surgery and get rid of that implant or replace that implant. The surgery is less problematic than if you wait for complications to occur like capsular contracture. I wish there was a perfect implant that has no potential failures, but that's just not the nature of life. So breast implants are no different than any other type of medical implants that potentially fail. So it's important as you, as a patient, that you understand this and you do all of the proper screening. Pay attention to how your own body looks and feels. Do self-exams every month and let your surgeon know if anything changes.